Hello, everyone. It's Wednesday, April the 14th. Normally speaking, this would be a little bit of a dreaded day, thinking that our income tax filing and everything had to be done on the 15th. I think your estimates are still due in, but we have extended that out, and there's no point in me going back through all that. But if you'll just watch and everything that you're in compliance and everything, and follow the guidelines as we've extended it out just a little while. I regretfully got to report to you we've lost 11 more great West Virginians. Of these 11, the youngest age is 53. The oldest age, and glancing at it real quickly here, is 94. We can see real quickly that this disease continues to attack age, and age. And so I'll ask again for your prayers for now 2,756 great West Virginians that we've lost, and for these 11 today. But our 2,746th death is a 73-year-old female from Ohio County. Our 2,747th death is a 77-year-old female from Wyoming County. Our 2,748th death is a 73-year-old female from Harrison County. Our 2,749th death is a 53-year-old male from Marshall County. Our 2,750th death is a 94-year-old female from Berkeley County. Our 2,751st death is a 65-year-old male from Wood County. Our 2,752nd death is an 89-year-old male from Marshall County. Our 2,753rd death is a 56-year-old female from Cabell County. Our 2,754th death is a 90-year-old male from Wayne County. Our 2,755th death is a 59-year-old female from Raleigh County. Our 2,756th death in the state of West Virginia is a 68-year-old male from Putnam County. Please don't let them become a number. Please keep them in your prayers. We've had 413 new positive cases in the last 24 hours. Our daily positivity rate is at 3.57. That's very good. That means we've tested a lot of folks. Our cumulative positive number is down to 5.22. That continues to fall, and that's really good. Our active cases have dropped just a little bit. I think that's right and everything. And now they're at 7,309. Our recovered cases are 137,138. And I think that trend line is of the top graph is starting to maybe get a little teeny bit better. We have 239 folks that are hospitalized and 57 in the ICU units. Both those numbers are a little better. We have 2 counties in the red, that's Boone and Berkeley. We've dropped Raleigh, and that's good. A reminder of our 65 and older group, please, if you have any symptoms at all, including just anxiety, go get a test. Go get a test. It may very well save your life, and it absolutely could very well save you from a miserable, miserable death. So please, if you have any symptoms whatsoever, go get a test. We can maybe possibly get you these antibodies and everything if we catch it early enough, and we can save your life. Everyone knows about Johnson & Johnson and the concerns, and I don't know that it's not, I'm not a doctor, and I'm not going to weigh in whether it's warranted or not, but if what we've had is 6 million vaccines of Johnson & Johnson given out, and we have 6 people that are having real problems or maybe have died or whatever from blood clots and whatever, it's 1 in a million. And so I hope and pray that the Johnson & Johnson folks can get this cleaned up from the standpoint of the safety, and because we want it incredibly safe. But this is out of an abundance of caution, and upon the recommendation of the CDC and the FDA, that all use of the Johnson & Johnson COVID vaccine in West Virginia was paused immediately until further notice. You know, we'll get back to you on that, but it is very important for you to know that there has absolutely been nothing except raving reviews about the Pfizer and the Moderna vaccines, and we will continue to have those available to you, and we are not going to slow up on our events. We're going to continue to push forward and everything. There's plenty of vaccines out there, and we need you to come in and get your shots, and please do that. Please, you know, I think there was a commercial on TV, you know, it's talking about, I think it was from Walgreens, and said, you know, now's our shot. And that was the theme of the commercial, and what that meant was, it's now our shot, West Virginia, it's now our shot, America, in every way that we can stop this thing, and the shot means get vaccinated. So we really need you to go do that. Before I go any further, I want to just tell you a story that just happened in the last, you know, probably 36 hours. But, you know, the other day, about 36 hours, 48 hours ago now, we announced the remote worker program that we had kick-started and was off and running in West Virginia, and we were going to start taking applications. We thanked Brad and Elise Smith for all their great work that they've done. We thanked WVU. We thanked all the great stuff that tourism is doing in the state of West Virginia, and absolutely our new secretary, Chelsea Ruby, and just all the great work that she's done and everything. And so all of a sudden, West Virginia is embarking upon a new horizon. We did that really 48 hours ago, and then within, you know, that evening, you know, probably less than 12 hours from when we were together, probably more like 8 or 9 hours from when we were together, my phone rings. And it's Secretary Ruby, Chelsea. And she's on the phone and she says, Governor, I just felt like that you really needed some great news, you know, because we'd been through this grandstanding and this ridiculous event, you know, from where the House had been on my, you know, personal income tax and all that. And so I just felt like you'd really need some good news and everything. And I wanted to tell you that since we announced this program for remote workers to come to West Virginia, now think about this, we had 50 spots. And in order to make application, it takes someone probably an hour to fill out all the paperwork and do all the stuff to make application. We had 50 spots in Morgantown. Shepherdstown and Lewisburg are not stood up yet, so they can't take anybody yet. 50 spots, okay? She said, Governor, do you realize in the last 2 hours that we've been up, we have over 200 applicants that have filled out the whole hour-long application process in 38 different states. Well, I told Chelsea, I said, that's good news, and I was really happy about that, and it made me feel good and everything. In one way. In another way, it was probably a little bit sad, and I'll get to that right now. But so then last night, at 9:15, Chelsea calls back again. Governor, let me give you an update, Governor. Now just think about it. Governor, now we have 55,000 people. 55,000 people that have inquired about the possibility of coming to West Virginia. And 2,000 of them have absolutely filled out the entire application. Less than 36 hours from when we had announced it. Now, where I'm a little bit sad is just this. I hope and pray that our House comes to the realization of good sense. So many people have looked at me over the personal income tax and said, well, how do you know they'll come? How do you know they'll come? Just think of what we missed. And just think of what the spotlight is on West Virginia right today. And just think of the opportunity to quit losing population and grow population. I hope and pray that in the days and the weeks ahead, as we go out and we try to tell you the real true story of how you could have had money in your pocket, we could have absolutely turned our local businesses, small businesses on like crazy, and how we've missed a situation to where here is more testimony. In 36 hours, 55,000 people have looked at West Virginia, and 2,000 have filled out an application that took an hour out of their life to do it for 50 spots. 50 spots in West Virginia. My. I really hope and pray that we do not go down in history as doing the absolute thing that hurt us when we had the moment right at our hands. We had the moment to absolutely turn the floodgates open for people to come to this great state. Help our schools, help our roads, help so many things. This remote worker program is good, but can you just imagine a state where people are looking at right now, where they could come and not have income tax? Absolutely, they would have come in droves. As far as our vaccine eligibility is 16 and above, we're urging the young people absolutely like crazy to take this vaccine, and we're asking their elders and everything to help us, to help us get them vaccinated. Our vaccine distribution update, we're at 91.7%. Our goal is always 100. We have now in the arms of people 1,114,670 doses. It's great work by a lot of folks. You know, folks in all the health clinics and folks on all the front line, our National Guard, DHHR, so many people are doing great work. As far as they're saving our wisdom or maybe even saving their lives, we stepped up, did we not? We have now in the arms of individuals 258,353 first shots, 65 and older, and absolutely 219,536 of them have absolutely gotten their second shot. We're over 75%. We keep pushing like crazy. We need to get to 95%, 85%. I got to tell you another little story real quick. My executive assistant, Pam Rhodes, told me yesterday of a lady and everything that was, you know, an elderly lady. I think her age was maybe close to 95 years. You know, she didn't want to take the vaccine, you know, and basically their kids and everything, they kept them close home, and they did schooling virtually and everything else. And then I think one of the kids was working somewhere and everything and came home. They all got it. And now, very, by the grace of God, the lady that was the elderly lady was hospitalized, but is doing okay. Now, please, I think now they're all vaccinated. I don't know exactly any more details than just that, but I know the premise of a story, you know, that this psyche, well, I don't want to take that vaccine. I don't want to do this and everything. That story has a happy ending. Most stories don't have a happy ending. You know, so absolutely you've got to take the vaccine. Please do. You know, on our manufacturing outreach, any company, any church, any school, any ball team, if you'll contact us, we'll come running and we'll get the kids or we'll get your employees or whomever it may be vaccinated. Our vaccine info line's up, our vaccine reminders, you know, I tell you over and over, please take the vaccine. You know, this taboo of being scared to death about this thing is silly. You know, I don't know how I could say this any more emphatically than this, but if everyone around me had had the vaccine and I was the only one left out, I would be running to get the vaccine. Please get vaccinated. As far as our testing, it's free, it's up on the map, as far as our drive-through, we thank Walgreens, Fruth, all the stuff they've done. Long-term care facilities, we have 10 outbreaks. We have 8 outbreaks in our churches. We got to watch and everything. That's in 6 counties. That's Fayette, Grant, Harrison, Kanawha, Nicholas, and Raleigh County. We got to watch. If we start to get these outbreaks in our long-term care facilities, it's going to really cause us a real problem. At corrections, we have 61 inmate cases, 8 staff cases. That's down from 101 inmate cases and 11 staff cases on Monday. We have 36 at the Southern Regional Jail, 34 at Salem Correctional Center, and 23 at South Central Regional Jail. The medical examiner now, let me get on down here and everything. I do want to report this, from the standpoint of, and I don't know what this note was on the, but I do want to report that we have now vaccinated 1,941 out of 10,146 inmates. And I don't know if that includes staff or not, but nevertheless, we have vaccinated almost 20% of what I think is our inmate population, and we continue to do so. And just because we've had the interruption in Johnson & Johnson, we continue to vaccinate, and we're going to stay at it until we get every single person there that wants to take the vaccine. Our guidelines are all up. The face coverings, still stays mandatory. I'm hopeful that that's going to leave us at some point in time, but just to up and say, well, we need rid of that and everything, because we don't like it. Well, I don't like it. But I'm not here to do just what I like and what I don't like. I'm here to do what the medical experts are telling me to do, and they're telling me without any question whatsoever, we still need to be wearing that mask. I encourage everybody about giving blood. From a standpoint of there's been a new thing that's come out on Monday, FEMA began providing financial assistance for funeral expenses incurred after January of last year, January 20th, 2020, for deaths that were related to COVID. The intent is to help ease some of the financial stress and burden that has been caused by this pandemic. FEMA will begin accepting applications for funeral assistance through their dedicated call line. Individuals should call the toll-free number that's up there or visit the website for details that are on the screen. As far as unemployment update in West Virginia, West Virginia's unemployment rate for March of 2020, right now, dropped to 5.9%. This is the first time our unemployment rate has dropped below 6% since the start of COVID in the COVID pandemic last year. We are now within 0.6 of a percentage point, 0.6 of a percentage point of where our unemployment rate was before the pandemic started. And our unemployment rate at that point in time was at records for several years in the past. So we're approaching records as far as our unemployment rate. This marks the 11th consecutive month where our unemployment rate has decreased in West Virginia. And West Virginia's unemployment rate is now better than the national average. We're bouncing back better than most states across our country. We continue to show the world that as we continue to push the right buttons in West Virginia, we're whipping this pandemic here, and we're doing so with our people that are back to work, and our economy is doing and built on a very solid foundation. We do continue to be that diamond in the rough that many folk missed. And so that's all I've got. I'll be answering your questions in just a few minutes, but thank you so much, and congratulations again to Chelsea and Brad and Elise Smith and all the folks that made this great thing happen in the state of West Virginia, because we have really shown the world again, and all of us should set up and take notice to the fact that, if that one thing, a remote worker program, is driving folks to this state, gosh, what we've missed with the personal income tax. But we're going to keep going forward. And we hope and pray that at some point in time when the public really realizes it, the House will be right with us too.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning. And to reinforce a few of the things the governor mentioned, yesterday we acted very quickly as a state in pausing the Johnson & Johnson vaccine. Because the Food and Drug Administration with the Centers for Disease Control made that recommendation. And as the governor said, that this recommendation was based on 6 total cases out of 6.8 million vaccines of an extremely rare occurrence called central nervous system sinus thrombosis. That is again, a 1 in a million event in people in the United States. The reason why the FDA and CDC, though, paused the Johnson & Johnson vaccine was because in this particular set of 6 incidences in women between 18 and 48 years old that occurred 6 to 13 days after the Johnson & Johnson vaccine, or that this was also associated with a reduction in the blood clotting factors, the platelets, which would be an unusual occurrence. And it resembles an immune-based problem that can happen related to the use of a particular blood thinning agent called heparin. So one of the concerns by the FDA and the CDC were in this circumstance of this unusual blood clotting problem, which clots the veins, the draining part of the blood from the brain that can back up some of the blood and cause more pressure, causing people to have headaches or blurry vision or feel dizzy or not feel right, is that the lowering of the platelets implies that there may be an immune process going on. And because of that, then the usual treatment, which would be the blood thinner heparin, would not be indicated for the treatment of this particular occurrence with low blood platelets and this unusual blood clotting problem. And therefore, the treatment would be different. So my understanding is that the FDA and the CDC and a CDC advisory committee is going to look at these cases, make recommendations, give us guidance, which will allow us not only to be able to, make sure we're treating the right people with the Johnson & Johnson vaccine, but also that we are treating any rare effect that we might see in a way that's safe and effective. And I think that, as the governor said, the real take-home message here is that the vaccines are all very safe, particularly, we've seen the Pfizer and Moderna vaccines really not have any associated problem or finding like we are seeing in this very few number of cases related perhaps to people taking the Johnson & Johnson vaccine, but also that everybody, federal government, state, are acting out of an abundance of caution and being careful to make sure that everything is absolutely safe. And again, these vaccines are all very effective, and the Johnson & Johnson vaccine is also very safe, given that even if this is an occurrence with the vaccine, that's 1 in a million. But suffice it to say that we know that these vaccines are really responsible primarily for the 90% reduction in deaths we've seen over the first 13 weeks of 2021, for the reduction in hospitalizations. And we know that the ultimate ending to our story here in West Virginia related to COVID-19 and in our country is going to be directly related to West Virginians and Americans who are going to choose to be vaccinated to protect themselves, to protect each other, because as we get toward the number of people that will get us into that range of herd immunity, this 75 to 80% or so of people who will become vaccinated and immune, then we know that we will be able to stop the spread of COVID-19 and the variants. And we're seeing more variants. We're up to 243 of the United Kingdom variants in West Virginia, which is a number that's growing. And that we know that the real key for us is to have all West Virginians who have not yet been vaccinated, who are eligible to be vaccinated, to please choose to do so. And in doing that, we are all running to the fire. We are all taking care of each other. And we are again shining the light brightly from the state of West Virginia for all others to follow. So it is really a critical time, and it is up to us. And while we're pausing immediately the J&J vaccine, we have Moderna and Pfizer and plenty of sufficient quantities to vaccinate everybody. And we anticipate that the J&J vaccine will restart soon with perhaps additional guidance from the FDA and CDC. So thank you very much.
All right, thank you, Dr. Marsh. Next, we'll go to Dr. Ayn Amjad, our State Health Officer.
Good morning. As Dr. Marsh mentioned, the Joint Interagency Task Force worked really quickly yesterday to pause the J&J vaccine after we got the alert yesterday by the CDC and the FDA. So we did contact all our partners in the state to pause this vaccine. As mentioned, we did also want to know how many vaccines were distributed throughout the state. West Virginia did receive 98,200 of the Johnson & Johnson vaccine. We had administered approximately 54,000 of the vaccines. We have not seen any of the cases that were mentioned, of the 6 cases that were mentioned throughout the country. However, we continue to monitor any adverse reactions that we might see. As mentioned, these are rare cases. Dr. Marsh did mention this briefly a few minutes ago. We do have a surveillance team out that will be monitoring any cases. Well, I do want to mention for any providers out there that if you have a patient coming into your facility, it is important to ask any recent vaccination history, because I think that is what the CDC and FDA wants to alert the public and healthcare providers about, that taking a good history of your patient, because of course the treatment, as Dr. Marsh went into, is key at this point. So wanting to know if your patient has had a recent vaccine is what the treatment's going to entail at this time. Right now, we do want to stress that vaccination is important. We still have plenty of Pfizer and Moderna available in the state. We are pausing right now with J&J. However, we have plenty of Pfizer and Moderna right now, where we're going to continue to want to vaccinate everyone in the state as possible. Thanks.
Thank you, Dr. Amjad. Secretary Bill Crouch with the DHHR is joining us today. Retired Major General Jim Hoyer is out today, but will be rejoining us on Friday. We'll now go to questions from members of the media. The first today from Mark Curtis with Nexstar Media.
Thank you. Good morning, Governor, Cabinet, and fellow reporters. First, before I get to my question, I have a request that I would like to pass along to Secretary Crouch and Dr. Amjad. Your dashboard, daily dashboard with the updates with the numbers is very, very useful. We love having it, but we would like to have a category added so that we could keep track of the variant cases as they increase across West Virginia. So if that's at all possible to add to the daily dashboard, we would like the variant cases included and updated every day. Now to my question, and it's not related to COVID. Governor Justice, yesterday, the NCAA issued a statement saying it would not allow any sports playoff games or tournaments to be held in states that had what it felt was a discriminatory policy towards transgender athletes. And with that in mind, have you made a decision whether you're going to sign the bill, veto the bill, or let it become law without your signature with regard to the ban that the House and Senate passed on transgender athletes participating in sports with the gender with whom they identify?
Mark, here's my feeling wholeheartedly. I wish that we probably would have been best, in some ways, let me back up and say, the addition of the college aspect could cause some ramifications. from the standpoint of how I feel about it personally and everything, I feel that absolutely we just cannot I just can't possibly get through my head that it is the right thing for us at a middle school level or at a high school level in our state, you know, for me not to support the bill. So I do support the bill, you know, and from the standpoint of even at our college level, I support the bill there as well. The only problem is just one thing, and that is this. The NCAA, you know, has moved to a more politically correct or liberal body. And they could very well penalize us in West Virginia. You know, there is some talk, you know, that we could come back into a special session and retroactively look back at it and everything. But Mark, I am either going to let it become law or sign it. You know, I am absolutely not, I'm not supportive of a veto in regard to the bill, you know, and so I am supportive of the bill.
All right, thank you, Mark. Next, we'll go to Stephen Adams with Ogden Newspapers.
Yeah, Stephen Adams of Ogden Newspapers here. Two questions. First off, in regards to the Johnson & Johnson issue, Dr. Marsh, I heard you say on Hoppy earlier that this might impact, I think we received, at least in the state, around 58,000, about 28,000 specifically for the state vaccine distribution efforts. So I guess my question in that regard is, compared to what we have in regards to Moderna, Pfizer, is this really going to be a big impact on what we are doing currently? It doesn't seem like it. And question number two for the governor in regards to the tax plan. Obviously, you're still upset with the House, but you're going to need them to pass whatever you need to pass. Obviously, you want to go on your road show and try to sell this to the people in hopes of putting pressure on House members. But at the same time, you know, are you going to try to talk to the House going further to find that third path that Speaker Hanshaw talked about at your forum for trying to find a way between the three different paths to try to pass a personal income tax phase out? Thank you.
Stephen, you got to remember just this. We all got together, all the majorities, House and the Senate and myself, and we all decided of the 10, 10, and 10 bills that we were going to run. I supported every bill that came to me from the House to the Senate, every single bill. I supported them all, and we all decided that we were all in on the personal income tax. Absolutely, that was what was told to me, Stephen. You know, and the other thing is, Stephen, it doesn't matter to me about the grandstanding of 100-0 vote. I mean, I know exactly. If I were a Democrat, I would have voted against it for sure. Because if I can keep a situation to where the governor that's a Republican and the House that's Republicans fighting with one another, I mean, I can see exactly why the Democrats, you know, were devoted that way. But the bottom line is just this, Stephen. They weren't even going to vote. What would have been the difference between a no vote and a vote that came out like it was? I mean, there is no difference, other than it was a grandstanding moment for the House and everything. But as far as talking to the House, working with the House, absolutely, I will do it, and I'll do it from now on. I want to be their best buddies. But at the same time, I mean, Stephen, you can't tell me, you can't sit with me and say, we're all in on the personal income tax and then just absolutely just throw it away. Stephen, it doesn't matter about the governor. It doesn't matter about the House. It doesn't matter about the Senate. It is the best thing for the people of this state, absolutely, 1,000,000,000 to 1. And absolutely, the people don't really realize that. So we've got to go out and we've got to educate the people. I mean, you just think about it. I mean, from the standpoint of the Republican leaders in this state, you know, Bill Cole, Woody Thrasher, Mitch Carmichael, Jim Justice, where are we all lined up? Craig Blair, where are we all lined up on this thing? You know, for us to be childish and say, oh, well, we all got together and voted, boy, we showed the governor and everything. It isn't a matter about showing the governor. It's a matter about the importance of what this is for West Virginians. I mean, literally, we showed the governor, we did, you know, but we turned right around and we took all these monies right out of the pockets of our people. It's not good. That's just not good. Of course I'll talk. Of course I'll compromise. I'll do that absolutely, just as I've done over and over and over. You saw every bill, every single bill go right through because I was supportive and I held up to my end of the bargain. And Clay and Dr. Amjad, you know, if you guys would take care of the first question, please.
Sure, I'm happy to start on. Stephen, thank you. I'll just clarify that for all sources, we believe that there is approximately 98,200 doses of J&J that were sent to the state of West Virginia, of which about 58,000 or so are put in arms. And that is compared to the over 1 million doses total that we've put in arms, which otherwise are made up of Pfizer or Moderna. So on the comparison level, certainly the number of Johnson & Johnson vaccines are much smaller than the doses and the number of injections, vaccinations we've made with Pfizer and Moderna. We have been really using Johnson & Johnson strategically for people who would perhaps be difficult to follow up with the second dose of vaccination. So people that have social instability, may have homelessness, may be homebound, maybe people in congregate settings that would hesitate to take a second dose of vaccine, or maybe people who may not be in the same place, like college students or others who may be, mobile. So we hope to, get Johnson & Johnson back into our portfolio, since it does have the benefit of having only a single dose to be, to allow us to fully vaccinate people. But we wait, as Dr. Amjad said, patiently, and we want to be careful as well, of course, with making sure that these vaccines are all absolutely safe. Pfizer, Moderna are absolutely safe from our perspective and incredibly effective. And Johnson & Johnson is absolutely very safe as well. But in this pause, we will make it hopefully even safer in our guidance for vaccination as it becomes reactivated. Aye.
The only thing I want to add to that, as Clay mentioned, a lot of our choices for vaccines are due to logistical issues, but we also know time saves lives. So if people are willing to take vaccines and we have Pfizer and Moderna available, we're going to offer that to anyone as well. So time saves lives and vaccines are available. So we'll shift our logistical method and we'll get Pfizer and Moderna to the people that want the vaccine. So we are ready to move as we need to. So if J&J is on pause, then we have other vaccines to move and we'll get those to the people that want them.
All right, thank you, Stephen. Next to Kenny Bass with WCHS and Fox 11.
Thank you, Kenny Bass, lifelong resident of West Virginia. Never got paid to live here. Still holding out hope for a biscuit coupon or something. But in all seriousness, Governor, with about 30% of the people saying that they probably wouldn't get the vaccine before anything happened with Johnson & Johnson, how much does this pause make more difficult to get people who are hesitant about the vaccine to take it now that they have something they can point to, even though it is only 1 in a million, and they can say, see, we told you it wasn't safe. So does it make your job more difficult to convince people who are hesitant? And what can you do to convince that group? Will you directly speak with them? Is it education? Is it making ads? Is it what tools do you have to try to convince those last 30% to get across the finish line? Thank you.
Well, Kenny, it makes it tougher, doesn't it? That's all there is to it. You got people that are hesitant, and it has, you know, it scares people. From the standpoint of how we get them across the finish line, you know, we continue to market, we continue to talk, we continue to have, you know, people out, you know, whether it be television commercials or whether it be all the kind of stuff in social media and on and on and on. But unfortunately, Kenny, you know, the sadness of the whole thing is, wouldn't it be terrible? Wouldn't it just be plain terrible that the only way we can convince them is more people die? You know, without any question, at the end of the day, if we don't get vaccinated, more people will die. You know, we'll continue our marketing efforts in every way. We will amp up our marketing efforts. There's no question that the Johnson & Johnson news will cause some more hesitancy in people. But absolutely, at the end of the day, I hope and pray that how they're convinced will not be at the expense of either their loved ones or a whole bunch of other loved ones that die. How many situations do you know? How many situations do you know of where somebody said, well, by God, I'm not taking that shot, and the next thing you hear is you hear about them being hospitalized, and you hear about them struggling to breathe, or one of their loved ones hospitalized that's passed on. How many situations do you know of that are just that? How many times do we have to see that and hear that for us to believe, you know, this situation needs you to take your vaccine? But Kenny, you're right. The Johnson & Johnson vaccine news will cause more hesitancy. The more we market, the better it'll be. I hope and pray that the reason people finally decide to take the vaccine, that they're the most hesitant, or that because they've seen body bag after body bag after body bag. Like I said, I just hope and pray.
All right, thank you, Kenny. Next to Charles Young with WV News.
Hi, this is Charles Young with WV News. So we're calling this a pause on the Johnson vaccine. So I guess that means we're assuming that after the FDA and the CDC looks into it, we will resume giving these at some point. What's happening to the remaining shots in the meantime? I know that the Johnson & Johnson vaccine doesn't have the same sort of storage requirements. Are we going to be able to keep these on a shelf somewhere? Thank you.
Dr. Marsh, please.
Yes, Charles, these store well, and so we will keep them in our inventory and continue to, you know, to wait for guidance from CDC and FDA, but we will be able to use these vaccines as we get the restart from the federal government.
All right, thank you, Charles. Next to Mark Cram with WDVM.
Good morning, everyone. We've danced all around the Johnson & Johnson issue. I guess we were pleased in the Panhandle to see the large-scale vaccination site at the Hollywood Casino launch yesterday. Will not having the Johnson & Johnson vaccine impact that overall? I understand, you know, you'll fall back on the other two vaccines, but going forward, will you be able to maintain the goal, for example, for the Eastern Panhandle was 10,000 shots a week? Will you be able, without Johnson & Johnson, to maintain that level of distribution? Thank you.
Mark, I appreciate the question and everything. I'm going to have to defer to Dr. Amjad or Dr. Marsh, but the person really to answer that is General Hoyer, and he's not with us today. But if you guys can add something to it, please do.
Governor, I can answer that. Mark, as far as I'm aware, we've been getting increased doses from the federal government of Pfizer and Moderna. So as far as I'm aware to date, we should be able to meet those allocations. Yes.
All right, thank you, Mark. Next to Paul Mullen with WCBC.
Good morning, Governor. Good morning, panel. Question in general about people that have had the vaccination that may have symptoms and may seek additional medical treatment. Do you keep track of that? Do you have numbers on that? Do you have anecdotal stories on that? How often is that happening? Mainly because people hear that if you get the second shot, you're going to get a bad headache and you may have to have additional medical treatment. Are you keeping track of those type of stories and statistics? Thank you.
Dr. Amjad or Dr. Marsh, it's you guys again, please.
I'll start. Yes, so we do keep track of that. Any adverse reactions has to be reported to the acronym is VAERS. It's a Vaccine Administration Error Reporting System. So anything as mild as nausea, headache, anything like that does get reported. So if you get a shot at a certain clinic, that will get reported to that vaccine site, and that gets reported to that administration system, VAERS it's called. Anything really severe, of course, can get called into our hotline number. Dr. Elizabeth Sharman is our poison control center or hotline. Anything major reported gets called into our epidemiology call center line. I'll get called, Dr. Marsh will get called. So we get a lot of calls for anything really, really major, but anything minor, even headaches, nausea, rash, gets called into that and is reported. And all that information gets reported to the CDC, FDA, which is how they got this information of even the Johnson & Johnson pause. So yes, that's all reported, and we get weekly reports on those updates as well. But I don't know if Clay wants to add anything.
The only thing I would add, and Ian did a really nice job of reviewing the process, is there's really two, I think, kind of distinct situations. So one is in the immediate time frame after vaccination, the first 24 to 48 hours, where people oftentimes will have some soreness in the arm, maybe some mild flu-like symptoms, et cetera. And then a bit, spaced out longer time from a single dose or the second dose of a 2-dose regimen vaccine, where if it happens, after the first several days, as we saw with the Johnson & Johnson, perhaps, effect of this clotting problem that we talked about, or if we see people get symptoms after that, we start to think about either other processes or maybe even breakthrough cases where people who may have been immunized or who may have gotten over having COVID could perhaps become reinfected with the virus. And these vaccines are really, really effective, 95% effective to prevent, the infection with the native virus for COVID. But we do see some people who, even though they've been vaccinated, can get infected, still protected against, hospitalizations, death after vaccination. But that is a bit of a different approach where we start to delineate the people that might have so-called breakthrough infections after vaccination.
All right, thank you, Paul. Next to June Leffler with West Virginia Public Broadcasting.
Hello, Governor and panel. I was going to ask about J&J, but I think all of my fellow reporters got to that. So, one of the bills that's going to be heading to the governor is Senate Bill 334. Governor, Saturday, you said, you mostly support this and you would probably let it go through. But I would love to get some comment from both of our health officers on the line about how they're feeling about this legislation right now.
Okay, docs or Secretary Crouch, you guys answer. I think Dr. Amjad can answer better than any of us on this, and I don't want to taint that answer. So, Dr. Amjad, you go.
Sure, June, I can answer that. That bill has a hot topic on the legislative floor, and the governor didn't make his statement on that, and we support the governor's decision. We have informed him about it, and it was discussed, and it's a legislative compromise that took a lot of policy into account. It took a lot of public comments into account, a lot of people came and spoke about it with a lot of knowledge about it. So our job at the state level is to follow the legislative ruling at this time. We have been working with Dr. Angie Settle at Health Right, Dr. Sherry Young, the Bureau for Public Health. A lot of people right now have been doing everything we can. Our job right now is to follow whatever the legislative has put into policy. So we've been working very hard over the last month to come up with what we need to do to address the HIV outbreak along with the CDC. So our job right now is to follow whatever the legislative has put into policy at this time, and that's what we're going to do. So we'll be coming up with our plan and putting it forward, but that's what we've done, and we agree with what the governor is going to put into place. But that's my comments for that, and we'll have more to follow. But thanks.
All right, thank you, June. Next to Kelsey Soto with WSAZ.
Good morning, Kelsey Soto with WSAZ. This is another Johnson & Johnson question, so I apologize, but probably Dr. Marsh or Dr. Amjad. We've talked about how the targeted group of J&J was the vulnerable and the socioeconomically challenged homeless populations, or those that are homebound. Are there efforts in place to kind of check in with those groups to make sure that there aren't any adverse reactions? Those are typically people that maybe can't medically advocate for themselves. Or are we prepared to pivot depending on what the CDC and FDA recommend here in the next few days about maybe retargeting who gets those vaccines? I don't know if there's been discussions or the ability and plans in place to kind of shift our the way we allocate those.
Dr. Amjad, you again.
We did have that discussion here at the JIADA and actually with Commissioner Jividen. So we are following. Most of those were gone out to, as Dr. Marsh mentioned, to any place that maybe couldn't have a second dose due to logistical issues. So our goal right now is to follow any patient through a surveillance program and to see if they have any side effects. But speaking with even, for example, the inmate population, one dose was logistically easier, but we are also interested in getting many people vaccinated as quickly as possible due to the variant. So we are going to suggest and offer the Pfizer and Moderna vaccines, for example, in the correctional facilities, so that those discussions are being made. But we, logistics wise, one dose is easier even for people who don't want vaccines. But we want people to get the vaccine. So if they are agreeing to get the vaccines, we are just going to get it out there. So that those things are in motion right now, but this information was just given to us yesterday. So we are working very hard to see what needs to be done. But we just had these discussions yesterday, this morning, and we are trying to move as quickly as possible to see what people want to do. But a lot of it has to do with even people not wanting to get 2 shots. So it's not just a logistical issue, it's a choice issue as well. So.
All right, thank you, Kelsey. Next to David Beard with the Dominion Post.
Hi, I'm passing along a question that was brought to me by some people. It has to do with school outbreaks. They told me that at a particular school, and I don't have permission to share the name of the school, it's not really relevant for the question, but that at this particular school, quite a number of students were asked to quarantine because a number of students at the school had tested positive. I can't say that school doesn't show up as an outbreak school on the Department of Education website. So their question and their concern is that what is the school's responsibility for reporting these cases, and how does the state enforce a school fulfilling its responsibility or failing to? Thanks.
Well, David, it's good to see you again. And under my executive order, the schools are mandated to work with the local health departments, and so I don't know how it could not be any clearer or be any clearer than that. But that's just that any positives or any outbreaks, they're mandated to be working with the local health department.
All right, thank you, David. Next, we'll go to Phil Kabler with the Charleston Gazette-Mail.
Hello, everyone. Looking at the DHHR dashboard, it looks like the doses of vaccine administered have really dropped off considerably in April. And as it was alluded to earlier, the poll survey by the Kaiser Family Foundation found that the two groups that seem to be most adamant about not being vaccinated are Republicans and evangelical Christians, of which we have significant numbers in West Virginia. So how specifically do we reach out to these people who are saying they definitely will not get the vaccine?
Okay, you know, Phil, I can add this. I think that that a lot of what you're looking at is, and again, General Hoyer is the person to answer that more than anybody, but I'm going to go to Clay. I could say that I think a lot of it that you're looking at comes from the federal program and not the state's allotment. But Dr. Marsh, if you could maybe add something to this, please.
Yeah, thank you, Governor. Well, Phil, as you are correct, that there have been surveys done of different parts of our country, different cohorts that have been trying to identify people that might be more vaccine hesitant than other people. What we're finding in West Virginia, as I think is true in most every state, is there are heterogeneities among different groups. Certainly working with the faith-based community, we do see uptake in many people who are, part of the faith-based community and the parishioners of those communities. Working with the Council of Churches, we've also seen, headway in many areas of folks that they are responsible for and who they represent. But as we have said many times, the real outcome for this pandemic in West Virginia, as well as in the United States, is going to be the people that currently have not been vaccinated, which may include people that are vaccine hesitant, but also may include people that just don't have sufficient access or education or whatever at this point, is going to be the success of each state to be able to reach those people, as Dr. Amjad said, in a very time-dependent way with vaccines. Because what we're doing now is we're trying to buy more time as the variants are growing in West Virginia to get more and more people vaccinated. We're also starting to assess all of the different doses of vaccine, because vaccine has become less centralized, through the federal pharmacy program and federally qualified health centers and veterans administrations, et cetera, along with the potential that people can go across borders to get vaccines, so that we make sure that we are identifying all West Virginians who have been vaccinated, even reaching down into CDC data lakes, so that we can have the most accurate information. Because ultimately, really what we're going for, as the governor has said, is we want 85% of our most vulnerable population vaccinated. That's the people over 65 and certainly people in long-term care facilities. But we really want to see 50% and then 75% of our entire population vaccinated. And that means that we really need all West Virginians to step up and choose to be vaccinated to protect themselves and to protect each other and to protect our great state. Thank you.
All right, thank you, Phil. Governor, I'll turn it back to you.
Okay, I just got an update on this too, and I think this is a fascinating number and everything, but Secretary Ruby Chelsea just sent word to my people. They just walked up and told me that now, as far as people that are inquiring about West Virginia's 50 spots right now on our remote worker program. Now it is above 65,000, and it'll be at 75,000 before the end of the day. Now just think about that. In 48 hours, that many people are looking at West Virginia because they know all the good things that have been happening in West Virginia. They know that all the national news broadcasts and everything, where I and others have been on the national news talking about just how great this state is, and they know that this is an opportunity to get away from a state where they're in, where all kinds of things are maybe happening, that they don't really like the way that things are going. 65,000, 75,000 by the end of the day. It's amazing, amazing. Now, I got to tell you one thing and everything, and I just thought about just a minute ago, and I jotted down here, and it's just this. You know, oftentimes our media group reports and says, well, Governor Justice's feelings, he takes things personal, and his feelings are on his sleeves and everything. Well, a lot of that's really true. And it's really, really hard for me to not be really proud of that. Because you see, I have a real passion and a real love for West Virginia. This job's really tough, and it's thankless in lots of ways. Now, a lot of people have decided through the years that they wanted this job because they wanted the status, or they wanted the ego, or they wanted the next hot tip, or the money, or whatever it may be. But you see, none of that interests me at all. You know, I do really care. And I'm proud of it. I grew up in a household where my dad, when a task became really, really tough, he looked at me when I said, Dad, there wasn't anything I could do. And he looked right at me as he grabbed me around my shirt and slammed me down on the desk and said, damn you, there's always something you can do, and you better damn well always remember that. Well, I'm telling you, my passion and my enthusiasm has taken me to where I am in all my life. Started out with grandparents that didn't have indoor plumbing. And absolutely, in my business career, in my career as your governor, the successes that we enjoy in lots and lots of ways are due to one thing, one word, and that's passion. Passion. You see, when I saw us miss the income tax opportunity, I knew what was out there. And right now, through the remote worker program, for 50 spots in this state, we have 75,000 people inquiring. I knew how important the income tax situation would be to a state that is losing population over and over and over. I knew literally how the world was looking at us. Now, in addition to that, I know how when we turned our back on people, our people, that we could have absolutely put more money in their pocket. And they don't understand it. It's almost like the people were surrounded in a scare tactic, a bubble that was saying to the people, we're going to tax you more. And it scared them. It scared them to the point where they absolutely did not understand. We took the money out of our people's pocket. We absolutely denied ourselves an opportunity to really grow. Yeah, I guess if you want to say, I wear my feelings on my sleeve, I could give a hoot in every way what the House did with their grandstanding effort. I only care just about this. Their grandstanding and showing their behind really just mooned our people. That's what they really did. You know, that's what I care about. I care about Toby that's out there that's busting his butt every day, or Edith that's working hour after hour in a second or third job. That we had the opportunity for them to have more money in their pocket. And we turned her back. I hate the fact for the flower shop or the dress shop that's downtown that all the people, if they had more money in their pocket, would have spent more money at those stores. I hate that. I really hate that the lobbyists controlled the day. The lobbyists that are absolutely controlling the day, and whether it be out-of-state money or whatever it be, special interest, I hate that. I hate the fact that the Senate stepped up right with me and absolutely said this is really important to West Virginia. And we absolutely just decided, well, we're not going to take it up. We're not even going to vote on it. And then even on top of that, we're going to just turn our behinds right to the people of West Virginia. Yeah, I guess I do carry my feelings on my sleeve. I guess I am absolutely all wrapped up in one thing, and that is just this. I am passionate. I do love our people. I really, really, really love this great state. And I want nothing but good for this great state. And I'm going to keep working at it every minute of the day until we achieve exactly that goodness. So as long as you have me here, I am going to be personal, and I am going to wear my feelings on my sleeve. I'm going to be willing to compromise and work and do anything and everything I can for one thing, and that is for goodness for all you. And I'm not going to stop. I'm not going to stop trying to do that because that is the only reason I'm here. I don't want anything for Jim Justice, period. So thank you so much, and God bless each and every one of you. You're really good. You're really good, and you deserve someone really working for you, and I'm going to do that. Thank you.